Hi, my name is Sarah Ray. Welcome back to my channel, and today I'm going to tell you the difference between IBD, Inflammatory Bowel Disease, and IBS, Irritable Bowel Syndrome. So first, IBD, Inflammatory Bowel Disease, is an autoimmune disease where your body attacks itself. There's such thing as called your normal flora, which is the good bacteria in your body, but in the body of somebody with IBD, their body attacks that normal flora, flipping on your inflammatory markers to fight those bad bacteria. And they stay on because it just grows back, damaging the intestines or whatever part of your GI tract that it's fighting. It burns it. The difference between that and IBS is a functional disease. Well, a dysfunctional disease. Pretty much your lining in your intestine is sensitive. So either it's doing too much work or too little work. If you take a scope inside the body of each person, you will see disease in the person of IBD, where you'll see nothing but a healthy colon in the person with IBS. IBS affects 10 to 15% of adults in the U.S. It does not cause inflammation, and it will not show up on tests. But some things that IBS and IBD have in common are some of their symptoms. Things like bloating in the abdomen, nausea, constipation or diarrhea, mucus in your stool, and pain. But IBD has some symptoms that IBS don't. Things like anemia, bleeding in your stool, weight loss, and fever. Ways they diagnose for IBD is through scoping and looking for diseased areas, biopsying that diseased area, or what's called a Prometheus test, which is a blood test to tell whether you have IBD or not. The way they diagnose for IBS is through symptoms that you have, and if you've had them longer than around 12 weeks, then they diagnose you with it. So what causes IBD? Well, they're unsure. But it could be genes that could play a factor in it. It could also be hereditary and the environment playing a factor in it. And what causes IBS? They're unsure about that as well, but they do believe it could be a miscommunication between your brain and your gut. So I hope that helps you differentiate between IBD and IBS, Inflammatory Bowel Disease and Irritable Bowel Syndrome, and help you understand them a little more. I hope you guys subscribe and like and leave a comment down below, and have a wonderful day.